My name is Harriet and I am 31 years old and I live in Westbury, New York. In October, I woke up with some of the worst pain that I had ever experienced in my life. I didn't know what it was, I had no clue what it was, and I just called my primary care doctor and he prescribed me with Cipro to treat what he thought was a UTI. I took the medication and it did not work. So then he referred me to a gastro doctor. She then ran a whole bunch of tests, MRIs, stool samples, blood work, everything, and everything came out normal. So from there, I was referred to a urologist who did the same thing. She ran a bunch of tests and everything came out negative as well. So my next step was to see my gyno, because I figured he was like the next one on the list. And I went to him and he completely dismissed my symptoms and my feelings and said, I think this is a gastro issue. I think that you should follow up with somebody else. And I remember walking out of that office and feeling completely defeated. And I sat in my car for a few minutes and I just let it all out and I cried. I don't have any answers and I don't know what the next step is. I then reached out to a high school friend who was a sports PT. And I asked her, I was just hoping that maybe she knew somebody that could help me out. And she luckily referred me to a pelvic PT in Stony Brook. She validated my symptoms and she listened to everything I was saying to her. And before I hung up the phone and made an appointment, she said to me, Harriet, before moving forward with you, I want you to see Dr. Ahmed at Pelvic Rehab Medicine. My experience with pelvic rehab was wonderful. I made a phone call and I immediately was booked for the next available date. When I went into Dr. Ahmed's office, I immediately felt like, this was the right place. I felt calm, and Dr. Ahmed entered, and she spent 4 hours with me on my first visit. 4 hours of listening to me cry again, watching me cry, looking through all of my tests, answering any questions that I had, questioning me, just really just hearing me out. I mean, I could barely get 20 minutes from any other doctor prior to seeing her. She thought that I had something called pubalgia, and she wrote me a script to go have an MRI, which was something that doctors had never really mentioned to me, didn't really know. And pubalgia is, the easiest way to describe it is like a sports hernia. I wasn't really an athlete, so I didn't really know where it came from, but to me at that moment, it felt like, okay, well, I possibly have an answer for all of this pain. She gave me the script for the MRI. She also put me on Cymbalta, which was for my pain and also helped with my mental state at that point, because I had hit rock bottom and then some. So I needed really to focus on my mental health as well. So she did that, and she also told me to continue with my pelvic PT with Melissa Amundsen out in Stony Brook. So that's what I did, and here I am 5 months later. The road ahead for me isn't guaranteed. I don't know what's gonna come out of it, but I know that Dr. Ahmed is the person that I can run to and I can go to when I need an answer or anything, is coming up in my health. She's the one that I can go to. So it was really just like the light at the end of the tunnel for me. If I could give advice to anybody, it's to just keep pushing. It's so easy to feel defeated and it's so easy to feel lost. The amount of suffering that I went through and the pain that I went through and all of the crying that I have done, it led me to pelvic rehab. And if I could help one person, it was just worth all of that pain for me. I would recommend pelvic rehab to anybody, and I do so as many chances that I get.